10 Early Signs of Dementia and How to It's common for everyone to experience forgetfulness occasionally. Whether it's misplacing your wallet, forgetting to call a loved one on their birthday, or struggling to recall why you entered a room, these lapses can occur, particularly when feeling stressed or sleep-deprived. However, as individuals age, their brains also undergo changes that increase the likelihood of memory lapses. If these changes begin to impact one's quality of life, it could indicate an early warning sign of dementia. Dementia encompasses various neurological conditions that affect memory, cognitive abilities, judgment, and the capacity to perform everyday activities. It's important to emphasize that dementia is not a typical aspect of the aging process. While minor forgetfulness can be expected with age, dementia involves a significant decline in memory function. To distinguish between typical memory changes associated with aging and signs of dementia, researchers have identified several warning indicators of the condition. Familiarizing yourself with these symptoms can facilitate early recognition, prompting timely consultation with a healthcare professional for diagnosis and intervention. 1. Memory loss that affects daily life. In contrast to the typical memory changes, where one may momentarily forget a date or a person's name but recall it later, a distinctive warning sign of dementia involves forgetting recently acquired information and being unable to retrieve it altogether. An illustrative example could be forgetting a conversation with a loved one immediately after it occurred. Memory loss associated with dementia may manifest as difficulty forming new memories, forgetting critical details such as home address, phone number, or spouse's name, losing track of necessary medications or appointments, reliance on memory aids like phone reminders or written notes. 2. Struggles with planning and problem solving. Individuals experiencing dementia may find it increasingly difficult to formulate plans, adhere to instructions, and tackle everyday challenges. These alterations are often referred to as executive dysfunction, denoting difficulties in cognitive functions such as planning and organization. This warning sign may be evident through failure to remember to pay bills, challenges focusing on activities such as reading or engaging in games, inability to comprehend directions on maps, or follow recipe instructions in cookbooks, repetitive questioning, disorientation or getting lost in familiar surroundings. 3. Trouble completing familiar tasks. Dementia frequently disrupts the ability to maintain a regular daily routine and complete familiar tasks. This alteration can lead to forgetting how to operate a phone or a remote control, prepare a meal, navigate to a familiar store, dress oneself or perform basic oral hygiene tasks like brushing teeth, participate in previously enjoyed hobbies. 4. Struggling to keep track of time, dates, and locations. Dementia often blurs the perception of time, leading to difficulties in recalling the day, season, or current location. It's important to note that occasional time lapses are common, particularly during busy periods or engaging activities. However, dementia-related disorientation can significantly impact daily life, presenting in various ways such as forgetting how one arrived at a particular destination, attempting to enter the wrong residence, mistaking it for one's own, perceiving the wrong season, such as mistaking winter for summer, sensing a disconnection with time, as if having traveled back to a previous period of life. 5. Changes in vision and spatial abilities. While it's typical to experience some vision changes with age, such as difficulty with near vision or the development of cataracts, dementia-related visual impairments can be more pronounced. This heightened severity is attributed to the direct connection between brain tissue and ocular functions. Since dementia disrupts brain cell functioning, it can also affect vision and spatial orientation. Consequently, individuals may encounter the following changes: difficulty reading words, challenges maintaining balance or walking, trouble assessing distances or spatial relationships, inability to discern between colors, increased frequency of dropping objects or tripping over items. 6. Experiencing difficulty recalling words during speech or writing. Individuals with dementia often encounter challenges in communication. This can manifest as a decline in understanding conversations or expressing oneself verbally or in written form. Such communication difficulties may lead to forgetting the intended topic mid-sentence, abruptly ceasing speech, repeating phrases or ideas redundantly, struggling to comprehend others' speech, misplacing or substituting words during conversation, uttering nonsensical or incomprehensible words. 7. Frequent misplacement of items. Misplacing keys or misplacing glasses occasionally is a common occurrence. Typically, individuals locate these items and continue with their day. However, dementia-related memory impairment can lead to persistent difficulties in finding misplaced items and struggling to recall their location. Placing items such as a watch or jewelry in unconventional locations like the refrigerator, concealing objects for safekeeping and subsequently forgetting the designated hiding place, accumulating unnecessary or broken items, sometimes to excess, engaging in searches for items believed to be lost, only to discover they were not misplaced. 8. Poor judgment or decision-making. Dementia frequently diminishes the capacity to focus on oneself or the environment and make sound decisions. Consequently, impaired judgment can result in questionable behaviors and inappropriate choices. Examples include neglecting to wash hands after using the bathroom, forgetting to attend to the needs of a pet, engaging in risky behaviors like crossing busy streets without caution, falling victim to scams or fraud due to impaired discernment, making unsuitable attire choices, such as wearing shorts or tank tops in inclement weather. 9. Withdrawing from relationships and activities. Dementia's impact on brain health often results in the loss of proficiency in tasks and activities previously mastered over time. For instance, communication difficulties stemming from dementia may lead to a cessation of initiating conversations with others. Similarly, if individuals experience frequent disorientation or difficulty following directions, they may opt to refrain from driving. Such alterations in one's capabilities can evoke feelings of isolation, loneliness, or disconnection, which can be profoundly challenging to cope with. In some instances, individuals may not even recognize their withdrawal until it is pointed out by a loved one. Examples of withdrawal behaviors may include avoidance of social gatherings with family and friends, decline in interest in previously enjoyed hobbies, neglecting regular activities such as walks or visits to favorite restaurants, inability to stay informed about current events or updates regarding favorite sports teams. 10. Emotional and behavioral changes. Dementia extends beyond cognitive changes to impact one's emotional and behavioral realms. Often, these alterations may be challenging for individuals to recognize independently, with loved ones typically being the first to notice shifts in personality. Examples of personality changes may encompass experiencing rapid mood fluctuations, feeling easily irritable, annoyed, or agitated, particularly in unfamiliar settings, manifesting symptoms of anxiety or depression, developing feelings of paranoia, fearfulness, or suspicion towards others, experiencing disturbances in sleep patterns, such as insomnia or excessive daytime sleepiness, encountering visual hallucinations or perceiving things that aren't present, displaying aggressive behaviors towards oneself or others, making inappropriate remarks or sexual advances, experiencing sundowning, characterized by confusion or disorientation during evening hours. It's crucial to note that early signs of dementia diverge from normal age-related memory decline. If you observe memory alterations in a loved one, prompt evaluation by a healthcare professional is imperative.